Medicare. You've probably heard the word 1,000 times, but what does it really mean? If you're turning 65 soon, helping a parent navigate retirement, or just want to understand how healthcare works in the US, this video is for you. Medicare can seem overwhelming at first, full of confusing terms, letters, deadlines, and costs. But don't worry, we're going to break everything down in a way that's easy to understand, even if you've never looked into it before. In just a few minutes, you'll know exactly what Medicare is, how it works, what the 4 parts mean, and how to make the best decisions for your situation. Whether you're planning for retirement, already enrolled, or just want to be informed, let's take the mystery out of Medicare together. So, what exactly is Medicare? Medicare is a federal health insurance program in the United States that mainly serves people who are 65 or older. It also covers some younger individuals with certain disabilities or serious health conditions like end-stage renal disease. The program began in 1965 as part of President Lyndon B. Johnson's Great Society initiative. Since then, it's become a vital part of healthcare for tens of millions of Americans. But Medicare isn't just one plan, it's made up of different parts, each covering specific healthcare needs. In short, Medicare helps reduce your medical expenses, from hospital stays to doctor visits and even prescription drugs, depending on which parts you enroll in. You pay into Medicare through taxes during your working years. Then, when you're eligible, you can begin using those benefits. Think of Medicare as a foundation. It's there to support you in retirement or during illness, but you need to understand how each part works to get the most out of it. Now let's break down the 4 parts of Medicare. Each one covers something different, and it's important to know how they work together. Part A is hospital insurance. It covers inpatient care in hospitals, skilled nursing facilities, hospice, and some home health care. For most people, Part A is free if you or your spouse paid Medicare taxes while working. Part B is medical insurance. It covers outpatient care like doctor visits, preventative services, lab tests, and medical equipment. You usually pay a monthly premium for Part B. Together, Parts A and B are known as Original Medicare. Next, we have Part C, also called Medicare Advantage. These are private insurance plans approved by Medicare. They often bundle Part A, Part B, and sometimes Part D into one plan, and may even offer extras like vision or dental. Finally, there's Part D, which covers prescription drugs. These plans are offered by private companies and help lower the cost of your medications. So to recap, Part A equals hospital, Part B equals doctor, Part C equals all-in-one plans, Part D equals prescription drugs. Understanding these parts helps you make smarter choices and avoid unexpected medical bills later on. Now let's talk about how to enroll in Medicare. If you're turning 65 soon, your initial enrollment period begins 3 months before your 65th birthday and continues for 3 months after, giving you a total of 7 months to enroll. You can sign up through the Social Security Administration's website, by phone, or by visiting your local Social Security office. If you're already receiving Social Security benefits, you'll usually be enrolled in Parts A and B automatically. If you're still working at 65 and have employer coverage, you may choose to delay Part B, but you'll need to enroll later during a special enrollment period to avoid penalties. For Medicare Advantage, Part C, or Part D drug plans, you can compare and enroll in plans using the official Medicare.gov Plan Finder. It's important to know your options and deadlines so you avoid late fees and gaps in coverage. If you're unsure, you can contact a Medicare counselor through your state's SHIP program, free, unbiased help to guide you through the process. Let's wrap up by answering some common questions about Medicare. Question 1. Is Medicare free? Part A is usually free if you've worked and paid Medicare taxes for at least 10 years. But Part B, Part D, and Medicare Advantage plans, Part C, typically have monthly premiums. Question 2. Can I keep my doctor? It depends. With Original Medicare, you can see any doctor who accepts Medicare. With Medicare Advantage, you may need to stay within a specific provider network. Question 3. What happens if I miss my enrollment window? Missing your enrollment period can lead to late penalties, and they can stick with you for life. Always check your timeline. Question 4. Can I change plans later? Yes, Medicare has an open enrollment period from October 15th to December 7 each year when you can switch plans. Knowing these basics can help you avoid costly mistakes and feel more confident about your Medicare choices. Let's quickly recap. Medicare has 4 parts. A covers hospital care, B covers doctor visits, C bundles both through private plans, and D helps with prescription drugs. Enroll during your 7-month window around your 65th birthday to avoid penalties, and use Medicare.gov to compare plans. It may seem complicated at first, but with a little knowledge, you can make smart, confident choices. If this video helped, give it a like, subscribe for more simple healthcare guides, and leave your questions in the comments. We're here to help.